All right, ready for a deep dive. We're tackling a topic today that's, well, more than just a cough.
Definitely more than a cough.
We're talking, of course, about whooping cough.
Ah, whooping cough.
And judging by this stack of sources you've given us, you mean business.
I
We've
do.
got CDC guidelines,
Oh,
insights
cool.
from the European Center for Disease Prevention and Control, even the Australian Immunization Handbook.
You gotta be thorough when it comes to whooping cough,
Yeah.
pertussis.
It's one of those illnesses that people tend to hear and they think, oh, cough, no big deal.
Right, they brush it off.
But there's so much more to it.
There is.
It's like the common cold's trickier cousin or something, right?
Yeah, I like that.
Because it spreads the same way, through the air.
It does.
But the effects are so much more intense and they last for such a long time.
They do. And to understand why, we need to zoom in, like way in,
Okay.
to your respiratory system.
Okay.
Imagine tiny little hairs called cilia lining your airways, and their job is to basically sweep out all the gunk you breathe in all day.
Okay, so like tiny little brooms.
Exactly, keeping things clean.
I like it.
Right.
Yeah.
But here's where whooping cough really throws a wrench in the works. The bacteria that causes it, Bordetella pertussis, latches onto those cilia
Oh, no.
and releases toxins that paralyze them. It's like gluing those brooms, the cilia to the floor.
Oh my gosh, your poor cilia. No wonder you end up with such a persistent cough.
Yeah.
I just thought it was like an aggressive tickle in your throat.
Oh, if only it were that simple. This is a full-on microscopic battle happening in your airways.
Wow.
Right. And speaking of battles, let's talk about the symptoms. That's where things get really interesting.
Okay.
And kind of deceptive.
Because it's not always as simple as, like, a whooping cough, is it?
You got it. It can actually start off looking a lot like the common cold.
Oh, no, really?
Runny nose, congestion,
Yeah.
maybe some watery eyes. Easily mistaken for something way more benign, especially early on. Sneaky. It's like it's trying to fly under the radar
It is.
before it unleashes this coughing fury.
Exactly.
So then, when the cough hits, how bad is it?
It hits hard.
Okay.
Intense coughing fits.
Yeah.
Sometimes so bad it can lead to vomiting.
Oh.
Or even a change in facial color from lack of air.
Okay. That's way worse than any cough I've ever had.
Right. And
Yeah.
you know that whoop sound everyone talks about?
Right. The classic.
Not everyone gets that.
Yeah.
Adults especially.
Oh, interesting.
They might just have a cough that lingers for weeks, even months.
So you could have whooping cough and not even realize it.
That's the thing.
Wow. That's kind of scary.
It is.
Especially for when you think about how contagious it is
Yeah.
and the risk to babies.
Exactly. And that's why it's so important to be aware of those less common signs. Especially in infants.
Okay.
The Australian source had a really important point about this.
Okay.
Babies might not have that classic whoop at all.
Really?
Instead, they might have apnea.
Apnea, that's pauses in breathing.
Oh, wow.
Much subtler symptom,
Yeah.
but potentially much more dangerous.
Wow. Pauses in breathing. That's scary,
It is a scary thought.
especially when you think about how contagious it is
Right.
and how important prevention is.
Yeah, you're right.
And when we're talking about preventing whooping cough,
We got to talk vaccines.
vaccines, they're always a hot topic, but
They are.
they're our best shot. Literally
We got a top pun intended.
at protecting ourselves and those around us.
Exactly.
And there's this misconception, that
Yeah.
one round of childhood vaccines
Right.
equals lifelong immunity. And with whooping cough, it's just not the case.
So what happens to those of us who got vaccinated as kids? Like, is it just gone?
It's not totally gone, but it does wane over time.
Okay.
Think of it like your immune system. Incredible as it is, sometimes it needs reminders,
Okay.
It's like that friend who's great at remembering birthdays until there's too many to keep track of. Too many birthdays. I feel that.
Right.
Yeah.
So the boosters are like those helpful little reminders for
Right.
your immune system.
So like those booster shots you hear about for preteens, teenagers, adults,
Exactly.
those are the reminder calls
Those are the reminders.
about it.
And they're especially important for anyone who's going to be around babies, right?
Like,
Because
quite-
they haven't built up their own immunity yet.
Right, so we've got to
Got to protect them.
protect them.
Exactly.
Okay, well, speaking of vulnerable groups,
Yes.
all the sources we read were very clear about pregnant women getting vaccinated.
Yes.
Why is that so important?
Well, it goes back to those antibodies we were talking about.
Right.
The ideal time is between 20 and 32 weeks of pregnancy
Okay.
because it allows the mother to build up antibodies
Right.
and pass those on to the baby through the placenta.
So it's like giving the baby a head start
Exactly.
on their immune defense before they're even born.
Exactly.
That's amazing.
Yeah, you're essentially creating this like protective bubble around them, especially for those first few months before they can complete their own vaccinations.
Right.
And this is where what's called the cocoon strategy comes into play.
The cocoon strategy.
Yeah, and this basically means making sure that everyone who is in close contact with the baby is fully vaccinated.
So parents, grandparents, any caregivers.
Everyone, yeah.
Working together to build that immunity fortress.
I love that. It really does take a village, right?
It really does.
It does.
But even with all of this evidence, pointing to the benefits of vaccines, there's always those myths. There's always those myths, those misconceptions floating around. It feels like everyone's always got a conspiracy theory or a scary story.
Oh, for sure.
About vaccines.
It's tough to separate fact from fiction out there.
It really is.
But that's what we're here for, right?
Exactly.
So should we tackle some of those common whooping cough vaccine myths head on?
Yes, let's do it. First up, can adults even get whooping cough?
Okay.
Because I feel like there's this idea that it only affects kids.
Right. Big myth. Definitely need to bust that one.
Yeah.
We talked about how that immunity from childhood vaccines, it can fade.
Yeah.
So adults are definitely not immune.
Okay.
And remember, they might not have that classic whoop either, which makes it even harder to realize.
So adults, we got to stay vigilant too.
Stay vigilant.
Okay, next myth, and I hear this one a lot.
Okay.
Does the vaccine cause SIDs?
Absolutely not.
Okay.
Multiple studies have debunked this.
Okay, good.
SIDs is a tragedy.
It is.
But there's just no evidence to suggest any link to the whooping cough vaccine.
That's reassuring to hear.
Yeah.
Okay, last myth for our little debunking round.
Okay, let's do it.
If you get whooping cough once, are you immune for life?
Oh, I wish.
Right.
Unfortunately, no. It doesn't work that way with whooping cough. Unlike some illnesses, having it once, unfortunately, doesn't mean you're in the clear.
Okay.
You can get it again, and so can your kids.
Oh.
So it's another reason why those vaccines are so important.
Right. So it's not just a childhood thing.
Not at all.
It's a throughout your life thing.
Exactly. Keep up with those.
Okay, before we wrap up, there were a couple things in these sources that really surprised me.
Oh, yeah.
Like, did you know that there are different types of whooping cough vaccines?
There are.
I had no idea.
Yeah, the Australian source got into the nitty-gritty of that.
Yeah.
They were talking about, like DTaP and Tdap and how they're formulated for different age groups. And
wow.
It's a whole other level.
That's fascinating.
Yeah, it is. It is.
Like a whole other deep dive waiting to happen.
Right.
Yeah. And then there was also, we talk about prevention, but what about treatment? If you do get whooping cough, you don't just wait for the cough to go away, do you?
I want to catch it early. Antibiotics are the primary treatment for whooping cough.
Right.
And they're most effective when you use them early on in the illness. That's why recognizing those symptoms is so important.
Yeah, so being informed can really make a difference.
100%.
In preventing those more serious complications from even happening.
Exactly. Knowledge is power.
Knowledge is power. I love it. All right. Well, we covered a lot of ground today.
We did.
We went from microscopic battles in your airways to debunking some pretty persistent myths.
It's been a journey.
It has. But we've only just scratched the surface, haven't we?
Always more to learn.
Always more to learn. Which brings us to our final thought-provoking tidbit for today.
Okay.
This is from the Australian source. Again, they mentioned something called immune blunting.
Immune blunting.
Yeah.
Any bells ringing for you?
A little bit, yeah. It's a fascinating concept.
Yeah.
It's an area of ongoing research, especially with maternal vaccination.
Essentially, it's this idea that if a baby's first exposure to, a vaccine-preventable disease comes from their mom's antibodies.
Right, from the placenta.
Exactly.
Yeah.
Their own immune response to the vaccine might be a little less robust.
Oh, interesting.
So it's
and their system doesn't have to work as hard because they've
already got some backup.
Yeah, a little backup from mom.
Exactly.
Yeah, it's so interesting.
But it doesn't mean the vaccines are less effective.
Right.
It's more about understanding all the complexities of how our immune systems learn and adapt,
That's fascinating. Immune blunting. Who knew?
Who knew? Right. All right, well, there you have it. Another deep dive conquered.
We did it.
Unearthed some surprising truths about whooping cough.
Yeah.
Busted some myths. And hopefully you're feeling a little bit more empowered, maybe ready to even tackle some of those tough conversations about vaccines out there.
Yes. Get out there.
Right. And hey, if you want to learn more about immune blunting,
Yeah.
you know what to do. Dive in.
Dive in. Embrace your inner researcher.
Exactly.
Well, thank you so much for joining us for another deep dive.
Thanks for having me.
Until next time.